This is the QTV Nightly News, which is also on Q Radio 103.3 FM, and I am Jul Denjai. Thank you for joining us. Here are the main news headlines. As the Gambia ushered in the new year 2026, Bundung Maternal and Child Hospital welcomed 3 newborns, including a set of twins, marking a hopeful and promising start to the year. Meanwhile, Kanifing General Hospital also recorded the birth of its first, second and third babies of 2026, bringing joy to families and health workers alike. Foreign ministers from more than 20 Muslim majority countries and the Organization of Islamic Cooperation (OIC) have issued a joint statement strongly rejecting Israel's recognition of Somaliland. And the Gambia Inclusive and Resilient Agricultural Value Chain Development Project, GIRAF, has officially handed over feeder road construction projects in the Lower River and West Coast regions to contractors. And the National Leprosy and Tuberculosis Control Program has launched a new pilot project aimed at strengthening health service delivery through quality and people-centered care. Those were the headlines, and now the news in detail. Thank you very much for staying with us. If you're just tuning in, this is the QTV Nightly News. Now, as the Gambia ushered in the new year 2026, Bundung Maternal and Child Hospital welcomed 3 newborns, including a set of twins, on Thursday morning. Yafatuge was there, and this is her report.
We're currently at the Bundung Maternal and Child Hospital, where anticipation is high as we wait to welcome the first babies of the year. The first baby of 2026, a twin girl, weighing 2.2 kilograms, was delivered exactly at midnight. Her twin brother followed at 12 minutes past 12 a.m., weighing 2.3 kilograms, while another baby girl arrived in between 3 minutes after 12 a.m., weighing 3.9 kilograms. All babies were delivered naturally. Stephanie A. Mendy, the doctor on call, successfully delivered the twins, while the second baby was delivered by a midwife, Sis Lillian U. Anna Ele. Both health professionals expressed excitement as being part of the hospital's first deliveries of the new year.
I really feel so excited this morning, having delivered twins, and then there was also another baby that was delivered. I remember this morning when I came to work and everybody was putting me to task, telling me the New Year's babies. In fact, some people were even warning me regarding these babies. And I'm like, anyway, I will just do what I can. So while I was here working, I did all my assessments. I know some people came and delivered, but I knew deep inside me that I would deliver somebody by midnight.
Babukar Sumare, father of the twins, expressed gratitude to the hospital staff for the smooth and swift delivery.
I am grateful for the professionalism and care I receive from the hospital staff. Thanks to them, the delivery of my babies was smooth and safe. I feel so happy and thankful for this wonderful start to the new year.
Fanta Seka Jau, deputy CEO of the hospital, expressed her excitement, highlighting that the first 3 babies of 2026 were born within a remarkable span of just 12 minutes.
This year we are so excited. You see, when I was sitting down here, I was telling them this year we will go earlier. Because last year we were here till around 2, 3. In fact, the third one we could not wait. Really. We were here till around 2. We could not. So we left them to just, the duty room was here to supervise. So we say Alhamdulillah, because this year everything had been very fast.
The birth of the 3 healthy babies, including the year's first twin within just 12 minutes, brought joy and hope to families, staff and the community, setting an uplifting start to 2026 at Bundung Hospital. Reporting for QTV News, this is Yafatuge.
Meanwhile, Canifing General Hospital also recorded the birth of its first, second and third babies of 2026, bringing joy to families and health workers alike. Let's have more details of that in this report. This was the atmosphere a minute to midnight at Canifing General Hospital as health workers stood on standby to welcome the first babies of the new year. The first baby of the year was born at exactly 12 a.m., followed by a second delivery 30 seconds after midnight, and a third 1 minute later. 2 more babies were subsequently delivered, bringing the total to 5 within the early hours of the new year. Health workers described the moment as one filled with excitement, celebration and a renewed commitment to delivering quality maternal and child health care services. Jariatu Drame, Principal Nursing Officer at the Canifing General Hospital, and Aja Sise, the midwife who delivered the first baby of the year, expressed joy over the safe delivery of all 5 newborns.
So the first baby of the year today, we have the first one happens to be a female, and the baby is just sharp 12 o'clock, we have the first baby of the year. And some seconds after 12, we have the second baby of the year. And the third baby is 1 minute after 12. And the fourth baby, we have it 7 minutes, and the fifth 10 minutes. And the first baby is a female, weigh 3.3 kg. The second baby weigh 3.34 kg. And the fourth one weigh 2.99 kg. And the fourth one weigh 4.8 kg.
I felt very happy anyway. It was a very interesting thing because the woman came just minutes before 12, and she came about almost fully dilated, about 9 cm. So for a woman to deliver, dilatation should be up to 10.
Bubakar Sise, uncle to the first newborn baby, and Abdul Wahab Sidibe, father of the third newborn baby, expressed gratitude to Allah for the safe deliveries. They also commended the nurses and midwives of Canifing General Hospital for their professionalism and dedication.
I am very happy at this moment. She is my brother's wife, and I thank Allah for her safe delivery. I deeply appreciate the nurses for their warm reception and kindness. And we pray for the baby to enjoy long life and grow up as a good Muslim.
Ana kontaan rek mashallah te mom dama kontaan bu baaxa baax.
I am filled with joy today because this is my first child, and words cannot fully express how happy and excited I feel. I am grateful to my wife and sincerely thank Auntie Mariama, the midwife, for ensuring a safe delivery.
As the new year dawned at Canifing General Hospital, the safe arrival of 5 newborns brought joy to families and staff, symbolizing hope, gratitude and a renewed commitment to quality maternal and child health care services in the Gambia. Reporting for QTV News, I am Julden Yai. Well, congratulations to all the newborn babies of 2026. Foreign ministers from more than 20 Muslim majority countries and the Organization of Islamic Cooperation (OIC) have issued a joint statement strongly rejecting Israel's recognition of Somaliland. The ministers say the move violates international law and threatens peace and security in the Horn of Africa and beyond. This report by Babukar Sise is narrated by me. Foreign ministers from Jordan, Egypt, Algeria, the Gambia, Nigeria, Pakistan, Saudi Arabia, Turkey and several other countries have unanimously rejected Israel's recognition of the so-called Somaliland region of Somalia. In a joint statement issued in Islamabad, the ministers described the recognition as an unprecedented and dangerous step that undermines Somalia's sovereignty and territorial integrity. They warned that the move could destabilize the Horn of Africa and the Red Sea region with wider consequences for international peace and security. The ministers also condemned the decision as a grave violation of international law and the United Nations Charter, accusing Israel of disregarding the fundamental principles of state sovereignty. reaffirming their full support for the Federal Republic of Somalia. The foreign ministers stressed that any action recognizing parts of sovereign states sets a dangerous precedent globally. The statement further rejected any attempt to link the recognition to efforts aimed at forcibly displacing the Palestinian people from their land, insisting that such actions are unacceptable under any circumstances. The joint statement was endorsed by foreign ministers from over 20 countries, along with the Organization of Islamic Cooperation, OIC. Reporting for QTV News, I am Julde Njai. We will now go for a commercial break. When we return, we have more local news stories for you. Do stay tuned.
The godfather of Afro Manding music, Jaliba Kuyate I album Kutakutole Fintindi Holy Saturday 10th of January 2026, Benjamin Hall, Paradise Suites Hotel, 9 p.m. VIP tickets $1,000, ordinary ticket $500. Father of the night Suleiman Diouf Brusubi, Mother of the night Musukeba Sane Trawale Germany, Chief Guest of Honor Momudu Turo Dabo, King of the night Honorable Muhammad Kante Busumbala, Queen of the night Nene Che Yasin Kebe, Auntie of the night Binta Batabali Sabali Kombol Lamen, owners of the night Honorable Sidi SK Njai, Mayor Talib Ahmed Bensouda, Make Kamara Salaji, brothers of the night Lamin Cham NPP, Kemo Sise GFF, sisters of the night Abiba Belgium, Fatou Kamara Petrogas, Maimuna Balde NPP, princess of the night Dr. Seina Bumbai Jaffa, lady of the night Nene Freda Gomez.
ndax pare nga def tànneeku ànd ak wér gu yaram buntu liggéeykaay United Nations seen bànqaas bi dox ci tëddee li ni dund ak mbayteef di Food and Agricultural Organization of the United Nations FAO ak ministre bi saytu wàllu wér gu yaram gi ñoo am ay sarta yoo xam ne nii danañu dimbale ngir nag ñu mun a wàññi sukar tey tamit ñu mun a am ndox ci suñu yaram njëlbeen wàññil sukar bi nga xam ne nii moom ngay jëfoo ci sa ataaya wala yeneen xeeti naan yu tàng yi tànnali tamit yeneen xeeti juus yi nga xam ne nii seen sukar dafa tuuti lu mel ni ki wonjo ak juusi buy oytul snack yi nga xam ne nii dañ ànd ak sukar ak juusi sachet yi nga xam ne nii ñu ngi koy jëf rawatina nag xale yi te it waxtu wu nekk naanal ndox ni xeeti naan yu sedd yi nga xam ne dañ am sukar lu mel ni ki soda ak juus yi ñuy defal nag coppali bu yéwén ci sa wàlli wér-gu-yaram te tamit nag ñu gën a yaxanal nag Gambia ci wér-gu-yaram goo xam ne ñun ñëpp ñoo ciy ànd toftal nag sarta yi nga xam ne nii moom lañ teg ci suñu xeeti ñami tànneef yi.
Welcome back. If you're just tuning in, this is QTV News. Now to the rest of our stories. The Gambia Inclusive and Resilient Agricultural Value Chain Development Project, GIRAV, has officially handed over feeder road construction projects covering 75.7 kilometers in the Lower River region and 34.9 kilometers in the West Coast region to contractors. Usman Jata reports.
Poor feeder road networks continue to pose major constraints to market access for smallholder farmers and small and medium-sized enterprises, often resulting in high post-harvest losses and increased transportation costs. The initiative is expected to improve rural connectivity and enhance access to markets for farming communities. The GIRAV project seeks to address these challenges through the development and rehabilitation of feeder roads across key agricultural regions. Subcomponent 1 of the project focuses on rural connectivity support, targeting the rehabilitation, maintenance and construction of priority feeder roads. At the handover ceremony in the West Coast region, Governor Usman Bojang and Honorable Ami Koli, Namfo Fonyi Bondali and community representatives welcomed the initiative, highlighting long-standing access challenges, particularly for women and vulnerable groups. The investments are expected to link beneficiary farming communities to markets and essential social services, In the Lower River region, the feeder road project includes the construction of 4.5 kilometers of roads under one of the designated lots. Governor C.D. Lamin Bah expressed appreciation for the successful handover of the project to contractors, describing it as a significant step towards improving livelihoods and strengthening agricultural value chains in the region.
This will ease our livelihoods, this will improve our access to remote areas, but this will also increase the level of awareness of local people to know that it's not only just the highway that is important, but there are people living in remote areas. And even health-wise, for pregnant women to come out is always difficult, especially if you know the history of this road. During the rainy season, vehicles cannot even ply the road, only motorcycles and or the ox carts. So, and this brings a lot of difficulties for especially pregnant women. But not only that, we are trying to promote the food self-sufficiency syndrome, of which Giraffe is spearheading. Building community gardens, putting boreholes in there, employing young people. What else can we ask for? These are issues that will really change the lives and livelihood of people. And we very much appreciate it from the authority, the district authority, the regional authority. You are making life much easier for us.
By formally handing over the sites to contractors, Giraffe aims to ensure readiness to commence construction, clarify implementation arrangements, and promote coordinated engagement among key stakeholders. The Gambia Inclusive and Resilient Agricultural Value Chain Development Project Giraffe is a World Bank-supported initiative financed through an IDA grant. Approved in November 2021, the project is being implemented over a 5-year period. Osman Jata, QTV News.
The National Leprosy and Tuberculosis Control Program under the Ministry of Health has launched a new pilot project aimed at strengthening health service delivery through quality and people-centered care. Lolly M. Kamara tells us more.
The official launch of the program Quality Efficiency PQE initiative for active tuberculosis case finding, along with the formal signing of contracts with Canifing and Brikama hospitals, brought together health workers and partners to mark a significant milestone. Mary Gomez, Program Manager for the National Leprosy and Tuberculosis Control Program, NLPT, said despite the progress made over the years, tuberculosis remains a major public health challenge. Many cases are still missed, diagnosis late, or lost along the care cascade. The PQE approach is designed to address these gaps.
Through this initiative, we aim to improve early detection of TB cases within health facilities and surrounding communities. We aim to strengthen referral, diagnosis, and linkage to treatment. We aim to enhance the capacity of health workers through targeted training and mentorship, and use performance-based monitoring to drive quality improvement.
Madam Gomez also highlighted the significance of the symbolic contract signing between the designated health facilities.
They reflect a shared understanding of roles, responsibilities, and performance expectations. Most importantly, they affirm our collective resolve to put patients at the center of care and to ensure that no person with TB is left undiagnosed or untreated.
Mohamed Lamin Dabo, Monitoring and Evaluation Officer at the NLPT, said the PQE pilot will start at 2 hospitals as learning sites for improving TB screening, diagnosis, treatment, and follow-up, with lessons guiding future nationwide expansion.
And we are happy to say that the Canifing General Hospital X-ray has been installed and has an artificial intelligence component, which is going to support TB diagnosis. So that means we are not only relying on clinicians, although the clinicians remain the key to TB diagnosis, but we have the AI to also support the diagnosis of TB.
Momodu Tinyasi, Director of Health Services at the Ministry of Health, said the PQE is firmly anchored in national health policies and standards, particularly those guiding service delivery, patient safety, infection control, and health system strengthening.
This alignment ensures that PQE is not a parallel effort, but an integral part of our national agenda to improve health outcomes. The Ministry of Health leadership remains central to this process. By supporting the implementation of PQE within our public health facilities, the Ministry of Health reaffirms its commitment to institutionalizing quality improvement as a core function of the health system.
Over the next 3 days, participants will turn PQE strategies into practical actions, strengthen systems, redefined workflows, and equip health workers with essential tools. Officials say this marks the start of an ongoing journey of learning, improvement, and impact, not a one-off activity. Slowly, I'm Camera.
Now, the Holland-based charity foundation Door and Voor by Anfor, Gambia, has donated essential firefighting equipment and other valuable items to the Gambia Fire and Rescue Services aimed at strengthening emergency response capabilities. Mam Naboka was in attendance, and this is her report.
The event took place at the Gambia Fire and Rescue Services headquarters in Banjul, where representatives from the charity gathered with GFRS officials to mark the occasion. Established in November 2023, Door and Voor aims to assist disadvantaged communities in the Gambia with a key focus on critical areas such as education, healthcare, and economic opportunities. This dedication to supporting local initiatives and institutions eventually led to the signing of an MOU with the GFRS, where an initial donation of fire extinguishers and first aid training materials was made in January 2025. This second donation, including a set of uniforms, band materials, and fire extinguishers, are intended to enhance the operational capacity of the GFRS and significantly improve the readiness and effectiveness of the firefighters to respond to emergencies across the country. Mbaye Jahate, head of Door and Voor, shared what inspired the donation, while Sankuli Ndao, chief fire officer of GFRS, praised him for the initiative.
When I was young, our compound in Birkama had fire before. So that touched my heart. I say whenever I have the chance to travel in abroad, the only thing I will focus is on fire service. With the help of the government, without the help of the government, we will never stop. We'll just go.
Our government cannot do it alone. As a citizen, you are part of the government. So coming up with this laudable initiation, equipments, materials here and there, I want to say a big thanks.
Masani Fofana, Deputy Operations Commander at the GFRS, and Samba Jacob Jaju, Assistant Chief Fire Officer, shed light on how significantly these new materials will help them execute their jobs.
You have added value to our department. We sent people to go and train band. We were thinking where to get these drums and other things. We will play our quota in it, and we assure you that these materials are going to be used well.
When you underrate this, there happens to be a small fire here, you think it's a small fire. Before they put it off, it can burn the whole station. How much is it going to cost the government to rebuild this station? So a gift that will extinguish fire is never a small thing. On that note, I wish to thank you once again for your generosity, and we hope to receive many more to come in the future.
Here is Bintu Koli, Secretary of Door and Voor.
It's sincerely coming from our hearts as a contribution of Gambians to Gambians again, and strengthening the capacity to serve our people, which is the Gambia. So we are thanking the Gambia Fire Service for welcoming us and also for accepting to be partners with us.
The donation by Door and Voor strengthens the Gambia Fire and Rescue Services capacity, enhancing emergency response, supporting firefighters on the front lines, and reinforcing community safety across the country. Mamna Buka, reporting for QTV News.
This is all we have for you in this edition of the News Bulletin, but before we go, here is a recap of the headlines. As the Gambia ushered in the new year 2026, Bundung Maternal and Child Hospital welcomed 3 newborns, including a set of twins, marking a hopeful and promising start to the year. Meanwhile, Kanifing General Hospital also recorded the birth of its first, second and third babies of 2026, bringing joy to families and health workers alike. Foreign ministers from more than 20 Muslim majority countries and the Organization of Islamic Cooperation (OIC) have issued a joint statement strongly rejecting Israel's recognition of Somaliland. The Gambia Inclusive and Resilient Agricultural Value Chain Development Project (GIRAF) has officially handed over feeder road construction projects in the Lower River and West Coast regions to contractors. The National Leprosy and Tuberculosis Control Program has launched a new pilot project aimed at strengthening health service delivery through quality and people-centered care. This is all we have for you in this edition of the News Bulletin. Do join us again at 10 p.m. for another News Bulletin. Thank you for watching and Happy New Year.